Prynawn da pawb, croeso i'r gweithdy adfer diogel. Good afternoon, everybody. Welcome to the Safe Recovery Workshop. My name is Claire Sterry and I'm Senior Officer, Third Sector Development here at Powers Association of Voluntary Organisations.
And I'm George Stroud. I'm Development Officer here at PAVO in the same team as Claire. I have a specific responsibility for governance.
So we're here today. Thank you for joining us. COVID's provided many challenges for the sector and, none more so than how we as third sector organisations move forward safely into the new normal. So we're very fortunate today. We've brought together a panel of experts to answer some pre-submitted questions in relation to this. Just to let you know that this session will be recorded, but it's only the panelists and PAVO staff who are really being recorded as such. So I'm delighted to welcome our panel, who will now introduce themselves. So if we can start with Harriet.
Afternoon, everyone. My name is Harriet Morgan. I'm a partner at Geldard's Solicitors, and I am head of the Charities and Not-for-Profit team.
Thank you. Helen.
Prynawn da bawb, I'm Helen Snow. I'm a specialist in employment and information law, also at Geldard's.
Thank you. Andrew.
Hi, I'm Andrew Baker. I work for Thomas Carroll Management Services and I'm an expert in HR and employment law.
Lovely, thank you. Irina.
Good afternoon, everybody. I'm Irina Friedrichova and I'm a health and safety consultant from Stalatke and Associates. So we specialize in providing health and safety and compliance guidance to organizations.
Lovely, thank you. And Jackie.
Hello, Jackie Thomas, Senior Trading Standards Officer, Powys County Council, currently heading up the COVID team.
Thank you, everybody. That's great. Fantastic. So without further ado, let's get started. As George said, we've got some questions ready for our panel of experts. So the first question is, COVID-19 has seen huge numbers of people working from home. How best can organisations accommodate the challenge of home working in the future so that it doesn't disrupt services and that it is done in an equitable way through the workforce? And if we can start with Helen, that would be fantastic. Thank you.
Yeah, sure. Thanks, Claire. I think there's a lot to think about in that question. There are a lot of different elements to be considered and thought through, particularly from an employment perspective. I think what the pandemic's done is really accelerated what was maybe a more general shift towards home working or agile working anyway. It sort of fast forwarded plans that I think some organisations had in place. And obviously we've been thrown into a situation where there's been a requirement wherever possible for employees to work from home. And that can be welcome for some, but it's not necessarily welcomed by everybody. And I think that's something that employers will need to get their heads around. Although the sort of perception is that home working makes things, easier, particularly if you've got childcare responsibilities or other reasons for finding it easier to work from home. It doesn't necessarily mean that everybody's going to be happy with the situation. You've got certain employees who maybe live at home and actually really enjoy the interaction of going into the office or into the workplace. And you've also got situations where you might have individuals whose sort of, domestic setup, whatever that is, isn't necessarily conducive to being able to work from home. If you do have, childcare responsibilities for young children, you might find it very difficult to be working from home. So I think what employers need to be considering is the fact that working from home is not just doing what people did in the office or in the workplace at home. There are different mechanisms and different dynamics of working that need to be taken into account when it comes to shifting the emphasis from office-based or workplace-based to home-based. As employers, there are certain things that you are required to do if you're requiring your employees to work from home. You need to be providing them with sufficient equipment and technology in order to enable them to be able to do their job. That's an implied term of the contract of employment. And I also think that employers need to sort of shift their mentality slightly in terms of how you manage a remotely based workforce. It's going to be, as I said, a very different dynamic to having individuals in a single workspace. So you need to be thinking about how you can keep in touch with your employees. What is the best mechanism? You're likely to be needing to be in touch with them more often, if anything, if you're working remotely, to make sure that, you know, everything is going okay, and you're sort of covering off what would be the normal sort of, you know, head round the office door chat, because that's just not something that's going to be available necessarily as easily if everybody's working remotely. Clearly, a key consideration is your IT systems, because individuals who are working from home are going to be heavily reliant on your IT systems being, you know, up to scratch and able to cope with the fact that everybody potentially is working remotely and not office-based. I suspect you've probably had to stress test those systems and networks over the past 6 months, and that if any of them weren't quite up to standard, no doubt you've had to address any glitches or issues. But that also, you know, leads on to consideration about, you know, broadband provision and things like that, particularly individuals working from rural locations where that can be potentially problematic for them. I think also you need to be clear about setting your expectations as employers of what is expected now that individuals are home working, and how that dynamic has shifted in terms of how you measure productivity and performance. As I said, how you keep in touch with your employees, both in order to check, you know, that they're doing what they need to be doing and you're getting out of them what you need to be getting out of them, but also from a well-being perspective, that, you know, all is well with them. If they have any issues, they feel like they've got a good outlet and a good mechanism of communication to get those issues aired. You also need to be thinking about data protection and data security. Having individuals work remotely means that as organisations, you're going to have less control potentially over what individuals are doing with personal data, confidential information when they're working at home. So there need to be clear parameters and rules as to what can be done with personal data and confidential information. For example, you want to make sure that individuals know that they shouldn't be sending information that's personal data or confidential to their own email addresses or their own personal devices, that you retain your control as a data controller over that within your own system, so within your email system, within your document management system. You might need to be thinking about what adjustments have to be made, or what adjustments individual staff members may request from you to make, you know, their working from home something that, you know, they can do at times possibly that wouldn't ordinarily be within working hours, but actually will suit them better because of obligations they have, as I said, in relation to childcare or other commitments. So adjusting working hours, you know, starting a bit earlier, maybe finishing a bit later, but having some time during the day when they're not actually at their computer. If that's something as an organisation you can accommodate, of course. And then I think the other important thing that I think has emerged over the past sort of 7 or 8 months is the fact that employees might need to be reminded about switching off and developing a sort of, you know, genuine switch off culture. Because I think what has been seen, you know, we hear about it in media, etc., is this idea that, yes, okay, home working in some ways is great, but actually it blurs the line between work and home, to the extent that some individuals may find it very difficult to switch off from work. And so instilling that culture within your organisation that, you know, when it's okay to switch off, when it's not your working time, it's not your working time, and it's very much encouraged that individuals take their time out. And that will help you comply with your working time regulation obligations in relation to rest periods and annual leave and things like that. You may also need to be thinking about how you're going to monitor your staff remotely now. So, you know, it's far harder in most scenarios to performance manage from a distance, to do that remotely. And it may be that you haven't needed specific KPIs previously, because you've been able to monitor during, you know, office time with everybody in the office. But it may be, if, you know, remote working is something that is embraced going forward, and that's very likely to be the case, to think about what KPIs, what key performance indicators you're going to put in place for individuals, so that they've got, you know, standards they know they're required to meet, and you've got then benchmarks that you can measure them against. I think the only other thing really to think about is, you know, in terms of expenses and covering off individuals who are incurring potentially additional costs, is that something when your organisation is able to accommodate in terms of some form of working from home allowance? And if so, to have that documented in a policy, I think is incredibly important so that everybody knows where they stand when it comes to that. In terms of, I suppose, the second part of that question, and sorry, I realise this is quite a long answer, but in terms of the equity, there's a lot for an employer to consider in these circumstances. As I've said, you will have more vulnerable individuals who may, really want to be working from home or may have to work from home. You may have individuals who have to work from home because they're self-isolating. You may have individuals who, I've said, have caring responsibilities and want to work from home. But you may also need individuals to be present at the workplace for certain periods of time. That's just something as an organisation you will need to figure out the balance for. And then in terms of distributing the office work, workspace working and home working, thinking about how to do that equitably, whilst at the same time making sure that your business organisational needs are covered. So if you do need people in, that's fine. And then trying to distribute that responsibility as equitably as possible so that you don't get industrial relations issues from people who feel that they're always the ones who have to be in the office, whilst others are able to work remotely consistently. But there will be specific categories of individuals where you'll just have to accommodate home working for them because of their specific scenarios.
Lovely, thank you, Helen. That was a really detailed answer, thank you. Moving on quite nicely now to our second question. Are there any solutions to time management to ensure staff are not under or overworking and that professional boundaries between the home and work-life balance are maintained? And I'm going to come to you for that, Andrew, if that's okay.
Yeah, certainly. As Helen said, really, the first thing is setting realistic KPIs is going to help, because if people aren't meeting those KPIs, and there's potentially an argument that they're not doing what they should be doing whilst they're working from home. I know that's not always possible to do that, set KPIs in every single role. But ultimately, if people aren't performing in their role, that's going to become obvious fairly quickly in exactly the same way as it is when people are in the office. I think the most important thing in all of this is communicating with your staff. So again, as Helen said, having conversations with them, speaking to them on the phone or over a Zoom call or something like that. Just to ask them the question sometimes, how is your workload looking? Have you got too much? Have you got enough? We deal with a lot of people, a lot of clients, and to be honest, the people who weren't performing from the office are the ones who aren't performing from home. The people who were performing from the office are performing from home as well. So that is something to bear in mind, is that I think your better staff are going to keep performing and keep doing what they should be doing, if not more, despite the fact they're working from home. You can get some apps that work that kind of time record, that monitor how much people are spending at their computers. That's quite useful to have as well, because that will also flag if they're overworking. One of the things I think that we are potentially at risk of losing with this is the sort of social aspect of working from the office, what you'd perhaps call the water cooler movement. I know a lot of people are implementing things such as having a Zoom call every Monday morning between 10 and 11, for example, where they all sit down with a cup of coffee and a biscuit and don't talk about work, but just talk about their weekends and just chat generally. That's something that you could potentially look to put in, because again, as Helen alluded to, a lot of people get a lot of their social interaction from work, and are we losing some of that in this pandemic at the moment with people working from home? The second part of the question, in terms of managing volunteer hours to support wellbeing, I think that's exactly the same. I think first and foremost, it's having conversations with them, setting them a realistic workload, and then monitoring whether it's done or not. But then maybe with a volunteer, you could think about providing them with a buddy or something like that, whose job it is to check up on them. Again, someone who's new to an organisation, are they going to have the confidence to call an established member of staff, someone who's perhaps more senior than, more experienced than them, to ask for help? They might have put their head around the door in the office, or put their head above the divide between the desks and ask that question, but it's a totally different thing picking up a phone to somebody. So how do we address that? And as I said, it might be a buddy system. asking their buddy to call them a couple of times a day just to make sure they're fine, because of course it's easier picking up a phone to someone than ringing them yourself, isn't it? So that's something else I would bear in mind. But I think the underlying thing here is just communicate with your staff and just staying on top of it as best you possibly can.
Just a couple of additional questions that have come in from attendees, Andrew, about tax breaks for home working employees.
So I think, I mean, I'm far from a tax expert. I've noticed there's a link going around to the government website that I think that's probably the best way of explaining that. So there is a really good link that explains what the tax benefits are. There is a work from home allowance that people can claim. Okay, brilliant, thank you. And do employers have responsibility for additional broadband costs? At the moment, I wouldn't say that they necessarily do, but of course, there's going to come a point where someone starts saying, well, actually, my contract says I'm based in the office, not based at home. At the moment, people are quite happy to work from home because of the pandemic, but I think there is going to come a time when people say, I want to come back to the office to work. If you want me to continue working from home, contributing towards my bills, etc. And we are seeing a little bit of that at the moment, although the counter argument that a lot of people are using is, well, you're paying X amount to travel in your car every day, so you save money in that respect. But I think there may come a time when people start saying, right, well, if you want me to work from home, I need this, I need that, I need a better desk. I mean, at the moment, people are muddling through, but at some point, I think that's going to change. Employers are perhaps going to become more demanding in terms of what they want in order to facilitate them working from home. Okay, that's really helpful.
If I can just add to that, Claire, I think Andrew got it spot on, really. And I think the key question for employers will be whether the individuals need what they're asking for in order to be able to do the work from home. Because if they do, then it is probably something that the employer should be covering the cost for. So there's no expectation that an employer has to cover the cost for, you know, super fast broadband just because an individual fancies watching Netflix a bit faster. But if actually it is a requirement that they do need it for their job because they're working on teams, because, you know, they're having to contact individuals and their broadband just isn't up to scratch, then I think there's much stronger argument for the employee to make in that circumstance then for that cost to be covered by the employer.
Thank you. Yeah, it's huge challenges going forward, isn't it? The Welsh Government are particularly keen at looking at extended home working, aren't they? So I think we're going to see some interesting times ahead of us. Okay, lovely.
30%, I think, isn't it? They want to get 30% of people working from home.
Yes, yeah. So yeah, it's going to be interesting. Lovely, thank you. Okay, on to our next question now. We've had lots of questions from, we've got big links with the village halls in Powys, and we've been interacting with them a lot because obviously COVID's affected them hugely. So who is responsible for the health and safety at our village hall? If we hire out the hall, perhaps it's best to just start off with that question first and then open up to the rest of the question. So if I can go to you, Arena, to kick off with that one.
Yes, I'll start with the generic responsibility.
Lovely, thank you.
So where they would lie. Now, there is an interesting guidance page on HSC website specifically for village and community halls and their legal responsibility. So that's something where everybody can have a look if they're not sure. But overall, obviously, anybody who is in control of non-domestic premises, and that would also obviously include village halls, has legal responsibilities under the health and safety law. So they have to make reasonable measures to make sure that the premises are safe, that access is provided, appropriate, the equipment or substances are safe. This is up to reasonable practicable. Now, reasonable practicable, that's a very common phrase throughout health and safety law, which means that you can balance the level of risk with the precautions you're putting in. So it's not absolute duty. Now, you can have a look at sort of like different layers of health and safety responsibilities, different levels. The first one, so the ultimate responsibility, will sit with the owner of the premises or whoever is in control of the premises. So the owner, which could be a community association, could be charitable trust, could be local authority, they will have the main health and safety duties, fire duties, and compliance duties. Now, they will have to make sure that the premises are safe, So they should be responsible for they normally would be responsible for the maintenance of the premises, making sure the whole premises are safe, fire precautions, so fire risk assessment is in place, for example, that any fire-related systems, arrangements are maintained and up to compliance. They will also be responsible for compliance issue regarding asbestos, for example, making sure asbestos surveys in place and in management regarding asbestos materials is in place. Legionella, for example, electrical safety. So they may be responsible for conducting electrical installation condition certificates or inspections and having the certificates done. Gas certificates being also gas inspections being done annually if there are gas appliances on the premises. So that would normally sit with the owner. Now that can be obviously transferred in a lease to a tenant. So if, for example, you've got a tenant who takes responsibility for the whole premises and the fully maintained lease, those responsibilities can be transferred, but that would depend on the lease then. Then you may have a second layer of responsibilities, which could be management committee. So they would be, again, if you got a management committee, even if they don't employ anybody and could be purely volunteers, they still would be seen as a legal entity under health and safety law, and they still would have responsibilities. And again, if they making decisions, if they they would become responsible for equipment being used on the premises, for example, and the basic safety and safety of people who may be using the premises, so the hirers, so any companies who may hire part of the premises. Then, and obviously, if there are more than one person or more than more organization, they would have to share the responsibilities between them. So there is that need for cooperation and coordination between them. Okay? And obviously then the last responsibility would sit with the user, and that goes with the COVID-19, for example. So the hirers are obviously responsible for the activities they conduct on the premises. They should be conducting their own risk assessment, sharing them with the whole, and they be responsible for people following those rules during those activities. And obviously, if that uses organization and they have employees, they would be responsible for them as well. So there's different layers, starting from the main compliance down to the users responsible for their activities.
That's really helpful. Thank you, Elena. There was a second part to that question, which I think you might have given a quick answer to, and that's if we hire out the hall for a permitted activity, who is then liable for the activity if COVID-19 measures are not followed? Harriet, has that come to you for this one yet?
I think carrying on from what Irina has said, there is a layers of responsibility here. The COVID regulations themselves in Regulation 21 do define the responsible person, and that's the person responsible for the premises. So if someone who is managing it or owning it, they could be seen as being responsible for it. And the responsible person must make sure that they've taken the reasonable measures in relation to the distancing, limiting face-to-face interaction, providing information about how to minimize risk exposure, and collecting contact information from people who are attending. So those would be your responsibilities as the responsible person. But as Irina has said, in terms of enforcement, if the people who attend then go on to contravene the regulations, they would then be liable for those contraventions as long as you, the responsible person, has made sure that everything has been put in place that you have to comply with under the regulations. I would say that Jackie may well want to come in here, but you can have a notice issued to close down the premises if those things haven't been complied with. So if you haven't, as the responsible person, complied with your obligations under the regulations.
Jackie, do you want to come in?
Yeah, I'd just like to mention that actually it should be a shared responsibility between the premise, so the regulated premise, which would be the halls, community centres, and the person who's doing the organised activities. And the risk assessments should at least run parallel, if not reflect each other. In terms of the liability, whether you could actually demonstrate beyond all reasonable doubt that somebody has caught COVID because of attendance at one of your activities, I'm not entirely sure that would be 100% successful, that you could prove it for liability, criminal liability purposes. given that the disease is community-wide at the moment. So in theory, the person who hires out the premises should be speaking to the person who's written the risk assessment for the community centre and making sure that they're on the same page.
That's brilliant. Thank you. That's fantastic.
Can I just add, there is a very interesting document which anybody can find, published by Third Sector Support Wales. And they basically publish a document, as you guys see.
Yeah.
But what I liked on that document is basically the advice regarding the higher contract that, as Harriet exactly said, I think if the procedure where it should work is that the whole puts a COVID risk assessment in place, the hirer should have their own COVID risk assessments, they should share them together, communicate them, agree on how they're going to comply with both of them. But for the premises to be protected, they really need to have some written agreement from the hirers regarding that they agree to those conditions. And on that document, it's a beautiful template with conditions you should set up basically for the people using the activity. So first of all, you need to make sure that the activities they want to conduct are actually permissible under the current conditions, because I'm absolutely sure if you allow activities which are not permitted, then you have no excuse. So that would be the first step. Make sure that actually you checking that those activities are permissible, and then have a signed contract with the hirers when you stipulate your conditions they have to follow regarding how many people on the premises are allowed, the social distancing. If there may be cleaning procedures you want them to follow while they are on the premises. And hopefully, if you put all that in place and you've got it signed and documented, that should give you protection regarding, liability for actually being closed down or somebody contracting COVID-19.
Yeah, that's really helpful. Thank you. Just to say that here at PAVO, we've been working really closely with the village halls. So if there are any village halls, community centres on the call and you need some support, please do get in touch with us. We'd be more than happy to help you. Okay, sort of connected to that question, we've got hirers of the hall need to take the details of those attending sessions for track and trace. And the committee keep a paper copy. How are we covered by data protection and what do we need to have in place to store this data? I'm going to start with you for that one, Helen, please.
Yeah, sure. Well, under data protection law, any hard copy data that's kept in a relevant filing structure, which is basically any filing structure you can search. So if you're keeping the documentation according to meeting date or anything like that, then you will be covered by data protection law. So you will have the obligations of the GDPR fall upon you as a data controller. That, in essence, means you have to establish a legal basis for processing that data. Well, in those circumstances, if there's a clear legal basis, you're required to keep that data for track and trace purposes. So you're not going to be finding yourselves in difficulty when it comes to establishing a legal basis. And what might be slightly trickier is the requirement to provide privacy information to the individuals at the point at which you collect that data from them. And it won't be necessarily something that you've either collected the data before or collected the data for that specific purpose before. So I think that probably means you've got two ways in which you can go about that. If it's an organised event where you have members who attend regularly and you've already got records of their personal data, you may have already given them privacy information, in which case you can just update that to include this track and trace requirement. If it's not, and this is data that you're collecting for the first time, then ideally you should, at the point at which you collect it, give them the privacy information, which can be a link to a website, or it can be a hard copy of the privacy information that the GDPR requires of you, which includes things like your reason for processing the data, your legal basis for processing it, how long you're going to keep that information for. From memory, I think it may be 21 days that you have to keep the track and trace information for after the date of the meeting or the activity.
Yes.
and also information about their rights in relation to the data. So it's a really cumbersome obligation on you as a data controller for a relatively small processing activity. So if you can tag it on to any privacy information you've already provided, all the better. Then in terms of your general obligations in relation to that personal data, it is to comply with the data protection principles. So make sure you're only collecting the data that you need to or that you're required to under the track and trace process, that you keep that data secure, you make somebody responsible for it. So it's, it's not something that people can inadvertently access or use in a way that the individual wouldn't expect. And making sure that you get rid of the data at the period after the retention period comes to an end, so that you are systematically deleting the data when you're no longer required to keep it. Provided you do all those things, I think you would be complying with your GDPR and data protection obligations.
Lovely, thank you. Anybody else want to add to that? No? Fabulous. We'll move on to the next question. Thank you, Helen. This is an interesting one. How do we ensure volunteers are who they say they are, as we are not able to meet them in person? And I'm going to come to Irina for this one.
Okay, well, I would probably recommend to whatever existing procedures and policies you had in place up to COVID-19, keep using them. You just may have to, instead of probably meeting the person face to face, try to do it remotely. So you can utilize, social medias, WhatsApp, Skype, Zoom, so you can actually see the person. Then I would expect that as a part of your existing procedures, you would have been checking their driving licenses or their passports. You can actually see the name and the picture. Again, you can ask them to email you copies of those. Be careful then how you keep them regarding the GDPR again, because obviously that information would have to be kept confidential and disposed of it in an appropriate way. But I would expect that existing procedures you had before, you would just carry on over, because even in the past, if you just met the person face to face but didn't actually check any of the documents, you still wouldn't know who they are. So there is no real difference in the principle. Then obviously you may have volunteers who may be eligible under DBSE checks, which are free for volunteers. So that's something would be next step for certain roles. So that would depend on the role of the volunteer. It's not legal requirement to have them done, but we would always recommend them if the role they're applying for is covered, is eligible by DBS, then we would always recommend it.
Lovely, thank you, Irina. On to our next question. I can't believe how quickly the time's going. This is an interesting one. We only employ 3 people. Do we need to carry out a risk assessment? And come back to you for this one, Irina.
This is a very common question. We see it a lot when we work with clients. And the simple question is, yes, you do. There is a common belief myth that health and safety law does not apply to small companies. There is this threshold of 4, basically. So it's slightly different requirements for companies with 4 and less employees, or 5 or more. Now, however, this belief is wrong. It can land your company in a significant risk if you don't. So now the completion of risk assessment is basically underpinned by the Management of Health and Safety at Work Regulations 1999, and there is an interesting section 3 which specifies very clearly, it actually states that every employer shall make a suitable and sufficient assessment of the risk to the health and safety of his employees to which they are exposed while they are at work, and the risk to health and safety of persons not in his employment arising out of, from, or in connection with the conduct of their undertaking. Okay, so it says very clearly that every employer needs to do that. Very similar requirement is even for self-employed. So even if you are just a self-employed person with no employees, you still are required to make a suitable and sufficient assessment of the risk to your own health or anybody who can be affected by your undertakings. Now, where the confusion came from is from the last point of this section, which states that where the employer employs 5 or more employees, he shall record the significant findings of the assessment and any group of his employees identified by being at risk. So you can see that actually you are not exempt from conducting the risk assessment, or small companies are not exempt from that at all. They just don't have to record them, okay? Unfortunately, this is a bit of a tricky area because if you can't demonstrate very clearly that you understand your health and safety responsibilities, and if you don't have anything in writing, then you may find yourself in difficulties and the number of scenarios. So if you have an accident, for example, or if you have an HSC or local authority may have to be involved, or if you get inspection by HSC, if you can't demonstrate it and you've got nothing written, it's very hard to demonstrate what you actually put in place. Okay. The same if there is an accident and you may have a civil claim put against you, the lack of any written evidence again will reduce your ability to actually defend the claim, because it becomes your word against the other person's word. Okay. So when we work with smaller clients, we do try always to recommend have at least basic documents in place in writing, because it's much easier than to keep on the top of things. You know what you've done. It's easier to communicate to your employees, have them signed. And if, as I said, if something does go wrong and you need to defend your actions, then you've got some evidence in place. So the answer is yes, you do have to carry out risk assessment. And I would recommend them have them in writing if you can, even
Lovely,
if you're...
thank you. Connected to this one, and probably come to you for this, Andrew, is a person's home a workplace for the purposes of the Health and Safety at Work Act and the regulations that apply to it?
That would probably be more of a health and safety question.
Okay. Irina?
What was the question again? Sorry.
Is a person's home considered a workplace for the purposes of the Health and Safety at Work Act?
It would under certain conditions, yes, as even if basically employers still have the same responsibility for their employees, even if they work from home. So obviously, as an employer, you can dictate your employee how they run their home and how they look after it. And if you've got the electrical, certificate in place, or if they have their boiler service, that's not something you can dictate them. But yes, you still have your responsibilities regarding risk assessment. So assessing any risks to your employees, we already mentioned that before, conducting DSC assessments, for example, display screen equipment, providing them with appropriate equipment. So technically, if you're providing your employees with IT equipment, it should be PAT tested, for example. So yes, certain aspects of health and safety will still apply. Yes.
Lovely, thank you very much. Okay, moving on to our next question. This is an interesting one, and this has come from a group that has received a grant through a PAVO administered grant scheme. I'm involved in a wellbeing project that promotes the playing of board games to improve mental health. Could it be argued that this is a voluntary service and that there is a reasonable excuse? And can up to 15 people meet indoors as long as face masks are worn? So I'm going to come to you for this one, Jackie.
Okay, yeah. Yes, it's a reasonable excuse. Mental health and well-being is covered under the reasonable excuses, and as is voluntary or charitable services. So that isn't a problem. The matter with the 15 people, that is the maximum for organised activities indoor, and that is permissible as long as you've got enough room to accommodate 15 people whilst maintaining 2 meters social distancing. So if those people playing games are in a relatively small room, then you won't be able to have 15. In terms of the face mask, that is the recommendation if you cannot maintain the 2 meter social distancing, and in any event, it should be in addition to additional measures such as ventilation and hygiene requirements. So it's not just a sheer numbers game, it is a matter of keeping everybody safe, which is what we need to keep an eye on in this the COVID situation. Despite all the 20 odd changes that we had on the second lot of legislation, it is all to keep people safe. So that's what you must think about, how you don't expose anybody who may already be vulnerable to additional risk. And to meet there with Irina's comments there on the risk assessments, you will need a separate risk assessment for your COVID requirements. unless you have incorporated it in your original one, which is unlikely, but you will need to have gone through the thought processes which are associated with risk assessment, which is a special skill, but there is plenty of help out there.
Absolutely, that's really helpful clarification, Jackie. Thank you. Harriet, have you got anything additional to add to that?
No, absolutely not.
No.
I agree. It could be a voluntary or charitable service, and yeah, I absolutely agree with what Jackie said.
Fabulous. We have been running risk assessment training sessions here at PAVO, so details of our training sessions are held on our website. So if you do need support with that, please do get in touch with us. But I think that was really clear. Thank you.
Next risk assessment training session coming up a week today, in fact.
There we are, lovely, and it's free as well. So please do sign on. We're here to help you. This is our last one question. I can't believe it. Time's just flown by. A lot of lunch clubs and village hall activities are run with the support from elderly volunteers. How do organisations protect their volunteers in the months ahead and when they are thinking of opening up or running services again? Irina.
Like according to the official advice, which is given by Welsh Government at the moment, they're not saying that people should be shielding again. So the advice for the people who were classed as extremely vulnerable and were previously shielding, or people at increased risk group, which could be older people. There is no, the only guidance at the moment, official guidance really is that they must strictly follow social distancing guidance, and that's the 2 meters. So the official guidance for any organization wants to bring older volunteers in is making sure that in your risk assessment, you do look very closely in how you can manage the social distancing throughout the premises, because you may have places where people may be meeting, so in the hall, for example, or kitchen, which may be smaller. And for a younger person, it may be fine to just pass by somebody, because if it's under 15 minutes, it wouldn't be classed as a close contact. But for vulnerable groups, that should be avoided under any circumstances. So really is looking the social distancing seems to be the crucial part on this. And then obviously anything else, making sure that all the other guidance are taken into account and are adhered to. So the cleaning, hands washing, but really the social distancing seems to be the main point, which is the official guidance.
Okay, lovely. Do any other panel members want to add anything to that at all?
Can I just add something to that a moment? Because it just occurred to me, kind of from a volunteering best practice point of view, absolutely in agreement with what Irena said, obviously, but just that it's important to make sure that your volunteers are comfortable with what you're asking them to do in whatever new circumstance it is that you're asking them to do it. So obviously it's really good to reassure them that you're intending to do X, Y, and Z to make sure that they're as safe as possible. But it's also a good idea to maybe have conversations with them individually so that they have the opportunity to say, well, I see you're doing everything you can, but I'm not comfortable with it. And then you want to be receptive to that and say, well, okay, that's all right. We'll find someone else who's able to do that's not a problem. Do you know what I mean? It's a question of making sure that conversation is had and possibly not had in a group context where people feel like they can't say no, as it were. It's just some thoughts that I have. Thanks, Claire.
No, that's really valuable. Thank you, George. Okay, so our last question now. If we carry out a robust risk assessment and put in place the mitigation and do everything we can we be held liable if someone feels they contracted COVID in our premises or during one of our activities? Harriet.
Well, I think we've probably touched on this and covered this earlier. And I agree with Jackie that when she said earlier that actually it's going to be extremely difficult to show where exactly you picked up the virus, and therefore for anyone to bring some sort of action against you, because it's going to be very difficult evidentially for them to show that they got it at your event specifically. However, I mean, the important thing, as everyone has stressed, is to make sure that everyone is safe. So to follow the regulations, but also to think about, are people safe in this environment? Am I doing everything that I need to be doing? Is it sensible to be running this event? Should we be doing it in a different way or delaying it? So I think if you haven't followed any of the regulations, certainly there is a risk of liability, but if you have your robust risk assessment in place, then I think liability is going to be very difficult to prove. But as people have said earlier, work with the people who are there, have a joined up approach, and think sensibly about making sure that people are safe in your environment.
Lovely, thank you. So we've come to the end of our questions. George, any feedback in the chat that stems?
Sure, not masses as yet. I've just put a little call out to people to let me know if there's things they'd like brought up. When we were talking about home working earlier, one of the attendees said that one thing they've done to kind of maintain a social aspect to work was to establish tight teams, made sure that they had induction procedures for people who are returning from furlough. So people who haven't been at work under the new situation, so they had, they could be brought up to speed, kind of felt they knew where everyone was at again. They also have a kind of a virtual cuppa 3 times in the week, with the offer being open to the whole organisation. Just kind of 15 minutes of being able to have a bit of a, like someone said, a kind of water cooler kind of chat, so that they're just kind of keeping people feeling engaged and involved and not all on their lonesome, really. So that's quite an interesting point of view. I also had a comment from someone when we were talking about kind of suitability of home offices and use of broadband, kind of pointing out that although you may be making home working an option for people, and it may even be the default if there is still office space available in the organisation, then perhaps employees could always opt for that, providing that could be made safe.
Yeah, indeed. I think that's right, George. I think we're looking at possibly sometime later on next year, the situation where organisations will have to start making decisions about what their workspace is going to look like going forward. Is it going to be, I think it's probably, obviously depending on the progress we get with various vaccines, etc., and likely that we're going to be in a situation very soon where everybody can be back at work all of the time. And I think, as I said at the outset of the discussion today, I think the pandemic has really fast forwarded this movement towards agile working, which I think was something that, a lot of employees were really gunning for anyway, pre-pandemic, because of the flexibility that it offers. I think it's going to be difficult for employees to walk that back now that, it's established that individuals can work from home. So I think realistically, we are going to be looking at some form of blended workspace going forward, where some office-based staff may still be in place. It may be a hot desking situation where individuals are able to come in on days when they need to for meetings or to meet external third parties, and then there will be some form of working from home element to their role as well. So it will be very much a case of blending those two together in a way that works for everybody, and in a way that's equitable for everybody as well.
And actually there is a third mode that we've got quite a few companies who started using co-working spaces. So they may not, their companies are sort of abandoning the idea of having a main office, but because they got employees who really struggle working from home for whatever reason, there is the option of having co-working spaces, so where the company will basically hire a little space for the employees to go to locally and work from. So that's another option, which lots of employees are opting for, obviously, once it's available again. It's
smaller I think in smaller organisations and smaller teams, I think it's going to all be about having a conversation with staff at some point. Like, look, guys, what suits who? Some people may absolutely hate work from home, want to come back and do 5 days a week. Some might be quite happy doing 3 days a week from the office and 2 days from home. And I think, as a starting point, I think if you can give people what they want or close to what they want, as long as, of course, that suits the organisation, that would certainly be where I started with it all.
Just on that kind of, again, talking about home working, I've got a question. I don't know whether any one of you has any recommendations about data protection procedures if volunteers are using their own equipment. I think we're talking about in particular kind of possibly computer equipment, home broadband, all that kind of stuff. Does anyone have any kind of thoughts about that situation?
I think if I jump in there, George, I think that there's probably 2 points really. First of all, if you are going to allow volunteers to use their own devices, you really do need to be thinking about putting a policy in place, a bring your own device policy it's called, which sets the parameters upon which individuals can use their own devices for the business of your organisation essentially. And I think depending on the nature of the sensitivity of the information that you're collecting about individuals, the strength of the security that they'll need to have or that they should have on their own devices, will vary. A really good source of information is the ICO's website, the Information Commission Officer's website. It's got lots of information about bring your own device policies, and I think it's got a template bring your own device policy as well, which you can then roll out to individuals. The key thing in that circumstance is ensuring that individuals appreciate the responsibility that is on them to ensure the security of that data when they have it on their own devices or in their own email accounts.
That's really helpful, Helen. Thank you very much. That's great. Anything else, George, that's come up through the chat pane whilst we've been chatting? You're on mute, George.
Classic. No, I think we've managed to cover a lot of the things that people have brought up during the session, at least. I don't know whether anyone else has something else to contribute. Maybe give them a couple more moments.
Well, whilst we're waiting to see if anybody else has got anything else they want to contribute, I'll just give the panel members a final opportunity to say something about how we move forward. If you've got a top tip or anything that should be considered, particularly, that would be this is your opportunity to say it. So if I start with you, Harriet, anything you'd like to say?
Well, from a general charity point of view, I would say make sure that your governance is in order. What this has shown to us is so many people do not know what's in their constitution or potentially where their constitution is. Make sure that you understand what your parameters are and make sure that it is fit for purpose going forward, because the situation of changes in how we work digitally is not going to go away. Many constitutions will need to change to keep up to date with that, and now is the time to be making sure your house is in order in that sense.
Yeah, absolutely. That's music to our ears. We're here to help the sector to do that. So yeah, absolutely. Knowing what your constitution allows you to do is just so important. Thank you, Helen.
I think from an employer perspective, thinking about, the move to home working for the foreseeable future and potentially beyond, I think it's really a question of understanding that, there is a change in mechanism and a change in dynamics for individuals working from home. It's not just a case of doing what they were doing in the office at home. It's a different environment. There are different considerations. And so you need to be thinking about how you address those changes as an employer in order to make sure that you're getting what you need from your staff and that your staff are getting what they need generally in terms of their well-being.
Lovely, thank you, Helen. Irena.
I think I would just agree with Helen on that, and just making, because the home working is going to be big, and just from health and safety point of view, it's just a different point. The employees are still there, the companies are still responsible for them. So especially I think the mental health aspect is really coming out at the moment. So things like, employing mental health first aid, just having that, wellness, well-being support for the employees. And that don't forget your legal responsibility regarding the risk assessments, even for the home workers and the DSE assessments and things like that. It's just, yeah, it's not going anywhere. So
no, lovely, thank you. Jackie.
Just a bit of a plug, really. In Powys County Council, we operate a free advice service for COVID. So if anybody does want any advice on systems to put in place or directions to any risk assessments or general discussions about what classes they can hold, or whether they're allowed to have people from England in the class, which has become a bit of a hot topic just lately. We are having discussions at the moment whether the venue would be responsible for encouraging people to break the law if they open classes on the border, say for instance in Knighton Community Centre, where people from England are encouraged to attend. Now, I would strongly recommend that you don't do that, because the penalties are quite high. The penalties are higher in England for crossing into Wales than they are for being in Wales when you shouldn't be here. So at the minute, we think it's a double whammy in that you get a fixed penalty notice from both sides of the border, and then there is an offence for the venue. So just to bear that in mind. But otherwise, we're really helpful. So give us a ring.
No, that's lovely, Jackie. I think that there's been so much information, and it's just come out so quickly, and it's so much to take on board. And, you know, everybody wants to do the right thing and keep people safe. Like you said earlier, that is the most important thing, is that we're keeping people safe. So that's great. Thank you, Jackie. Andrew.
Yeah, we have found that people are really, really positive when we're going around doing COVID inspections. People are really positive and welcoming, because they want people to have a look to see what they've put in place, and you know, they're really, it's you know, from an enforcement perspective, which is what we normally do when I'm not doing COVID, it's a very positive experience to have this discussion with people.
That's great, thank you. Andrew, anything you'd like to add?
Yes, thanks, Claire. I mean, I think for me, it's maybe not enough organisations have really taken stock of where they are with things. Things are changing. Back in March, we all sort of went to the office on Friday. By Tuesday, we were all rushing to get home on different devices and things like that. People probably are using their own laptops. Obviously, Helen raised some important issues there regarding the GDPR around that. You know, it's not just devices. It's are people leaving confidential documents on their coffee table, on their dining room table, things like that. What are they doing with it when they're finishing with it? Are they putting it in their recycling and putting it up the front with all their cans and bottles and things like that? Are they shredding it properly? Have we told them how to do it? You know, have there been employees in the organisation that haven't spoken to each other for 6 months because they haven't got each other's numbers? Should they have each other's numbers? Should we be collecting details for WhatsApp groups and things like that, so you can keep the so the camaraderie and that going? It's not just the social aspect of it. You know, certainly in our office, we bounce ideas off each other quite a lot around, you know, over a cup of tea around sort of the pods. We haven't had that as much. Can we recreate that? What about your more junior members of staff that learn off the senior members of staff just from watching them, interacting with them? Do they have the confidence to pick up the phone and ask them questions? How are they doing? So I think it's a case of sitting down, taking stock of where we are. What gaps do we now have because of working from home, and see how we can best plug those, really.
Yeah, I think that's really valuable, Andrew. I know just within PAVO, I mean, obviously, as a team, you know, George and I and the others, we meet regularly. We meet once a week just to touch base with each other and say hello and whatnot. And one of the nicest things we've done during the pandemic is we've been allocated a member of staff to talk to that we wouldn't ordinarily necessarily meet in a meeting or something like that. So it's just having that social contact with somebody and just checking in they're okay. So that's worked really well.
While you were all letting us know what your final thoughts, and it does follow on quite well from what Andrew was just saying, there's a question around the feeling that we're having lots of online meetings, we're working from home, we're kind of inviting people into our own houses. Does anyone have any kind of input in terms of whether there are safeguarding implications there, or kind of particularly in terms of if people are possibly going to get impacted in terms of health and well-being if their work is distressing at all, things like that? Is there anything that someone can offer in terms of what we might be doing to look out for people in that respect? I know it's a bit.
One of the things I wrote down for that question, George, really was I think is making sure, you know, going back to the cup of tea and a biscuit kind of conversations, is you're making sure that if people are having difficult conversations with service users and things that are potentially stressful and upsetting, that we also have, again, that water cooler moment, that cup of tea moment, because in the office they'd have had that conversation with somebody on the telephone or in a meeting room, then they'd have gone and spoken to their colleague about it and had that kind of therapeutic process. You know, can we put that, how do we put that in place? Maybe that is scheduling Zooms and supervisions and counselling and things like that when we know people have had that. So
Yeah.
that was my initial thought on that.
I was going to say we've had more regular supervisions since working home, which I think is a good practice, because it's quite easy to be, I don't know, become quite distant from people somehow, because you're not around one another in a kind of, you don't pass one another in the corridor or anything like that.
Lovely. That was really helpful contributions there. Thank you, everybody. So it's now time to bring the workshop to a close. It's been really enjoyable. I mean, I could sit and listen to, all afternoon. So diolch i'r panel, mae'r gweithdy wedi bod yn ddefnyddiol iawn. Got that right. Huge thank you to the panel. The workshop has been really, really useful. And diolch i chi I gyd am ddod. Thank you all for attending, and hwyl fawr and take care.